extension. Now we're going to test the flexor tendons. So we're going to start with the profundus. You guys see that? He's just flexing the tip of his DIP right there. And I'll just have my finger on this fingertip here. I should turn you this side. There you go. Push down. So you have to hold this joint and then have him push down. Push down. Good. Then this is the exam in the book. They're going to show you to hold these fingers down, and basically you're going to have him push against your finger here, and that's the sublimis tendon. Right? Technically, I think you could kind of stabilize it and have him push here, push down against your finger, and they're not using their sublimis to do that. It's just the profundus. I think it's kind of awkward sometimes to get like all their fingers flat against the surface. You're going to probably just do more of an individual thing. Then you're going to do abduction. So open your fingers up like this and push against my fingers as you open it. Okay. So you can test individually. If you're concerned about a finger, you're going to test their abduction. And there's one. I mean, this is an undergrad list. I'm just going to show you. If they have pain along the side and they're like they can't push, you're going to go to that finger and you're going to check their strength this way and that way. You're going to kind of check their ligaments and see if their ulnar or radial ligaments are injured on their fingers. Of course, we're going to check the thumb. Oh, where's that test? Oh, yeah, it's down below. Okay. So now we're going to do the wrist strength. Make your hand into a grip for me. You have to push up against my hand. That's the extension of the wrist. Push down. Yeah, could you guys see that okay? Push against me. And then push against me this way. Yeah, okay. So okay, we're going to check 2-point discrimination here.
Really quick before you move on to that one, which one was the opponent's strength?
Oh, I forgot the opponents. Thank you. So, I'm going to try to push your thumb, push away from him, push against my fingers, and try to pull your thumb over to the side. That's the way to do it. I think they showed you kind of like this, and you try to push against my thumb. You can do that. Basically, you're testing this strength right through here. So there's lots of different ways depending on what you're doing. Push down against me. That's one way to do it too. Did I forget anything else? Grip strength. Oh yeah. So squeeze my fingers. Hard as you can. Make them squeeze pretty hard. I mean, you want them to squeeze pretty hard. Okay. So sensory exam. So now you're going to do the 2-point discrimination. So I'm going to check your sensation on your thumb, your fingers, and I want you to tell me if you feel 1 point or 2 points. The dorsal aspect of the thumb. So close your eyes. Okay, so I'm going to tell them to. This is what it feels like. I'm going to do it somewhere else. I'm going to say this is 1 point and this is 2 points. Okay. So close your eyes and tell me if you feel 1 point or 2 point touching. And let's say they can't feel 2, they only say 1. You go a little bit wider. You guys can't see this, I'm sorry. You go a little bit wider until they can feel 2, and then you document that. You say 2-point discrimination at 1 centimeter, or if it's abnormal, you're going to say they couldn't feel 2 points until you're this far apart. So 1 or 2. Okay. All right, and then you're going to check the cap refill. Squeeze your finger and see how long it takes for them to. You can count in your head how long it takes. Check a couple fingers typically. And if they're injured the finger, you want to check that finger. Okay. Does anybody have any questions on those? Okay. So this is when they're having pain somewhere, and you're going to check. So he comes in, he's saying he's having pain here. I'm going to actually just start out by usually palpating this area, to be honest with you. This hurt here. Okay. You can put your thumb in your hand like this. And I'm going to, let's see. Yeah, like that. Can you guys see that? Let me see how I can do this so you can see it. There you go. See how I do that? And if they say, ow, that hurts, or pain right through here, that's a positive fecal stance test. grind test, which you have to come in and improvise this, but basically you're gonna be pushing the base of this first metacarpal down into that carpal bones, and you're going to kind of come, let's see here, basically you kind of stabilize the wrist, stabilize the wrist and you jam that thing into, jam the first metacarpal.
Can you show that a different way?
Yeah, I'm trying to see how I can. Yeah, let's see if it comes together. There you go. Put your hand like this. That's it. So we're stabilizing the wrist, you're pushing it in. Okay, so this is the omoplata ligament test. There's some. Okay, put your hand here and then press your hand. And this is. And basically you're pushing this way. Can you guys see that okay? Gotta go enough angle. And the book has you just push with one finger like this, but you have to stabilize this joint on the side. You can't let that go. You just stabilize that and you're gonna push this way. Now I typically, honestly, I take 2 fingers and I do this, I check it that way. And if it goes more than, I mean, you compare the other side basically. If it's looser than the other side or they have a lot of pain, then it's probably the next.
This one.
Okay, so I'm gonna do feelings test. Can you take your hand and hold it like this? You can show that, it's hard to describe it. Then you have them wait for a minute. It's minutes, do you have any numbs or tingling in any of your fingers? Okay, and if they say yes, you say, which ones do you feel it? You kind of, they sometimes might point to it, or you can kind of touch it and say, does it tingle or down here? Okay, go ahead and put your hand. Now let's test your carpal tunnel. Okay. Touch your, just to locate where you're going, touch your thumb and your little finger together for me. I'm gonna find his, sorry, this is making me much. A little bit off. Basically, you're gonna tap. Okay. Any tingling or numbness there? Okay. And then a couple tunnel compressions. Just pushing down with your thumb, basically. So 1 minute, and then see if you have any numbness afterwards. You don't. That's it. And if that was negative, you check the shoulder and the neck.